Uh, Good morning, everybody present today on this webinar. Respected Chairman, Secretary, and CEO, I welcome you all for the webinar. It's my pleasure to be a moderator for this webinar. I am Mrs. Munmun Mukherjee. Today, Indian Academy College and School of Nursing is conducting webinar on Nursing as a Career, Gateway to Bright Future. Our speaker, Mrs. Sujata Murthy, is a dynamic personality, excellent, experienced person in the nursing profession. She is extremely good in the profession and very dedicated nursing professional. I think Mrs. Sujata Murthy is the apt person to take you or lead you to a career in nursing. She is exemplary for all who want to pursue nursing as a career. So, I invite awesomest Mrs. Sujata Murthy for this webinar. We welcome you, ma'am. I also welcome Principal Elizabeth Lena, faculty members, guardians, parents of the aspiring students, and my dear youngsters. I'll welcome one and all for this webinar. Now I request Principal Elizabeth Lena to introduce our speaker for the day.
Hello, good morning. Good morning to one and all. It is my privilege to introduce our resource person, Mrs. Sujata Murthy, former Associate Professor of MS Ramaiah Institute of Nursing Education and Research. Mrs. Sujata Murthy pursued her master's from MS Ramaiah Institute of Nursing Education and Research in Medical Surgical Nursing. Madam has an extensive 25 years of teaching experience and 5 years of clinical experience. Madam worked as a senior nursing tutor for 10 years at St. Martha's College of Nursing, Bangalore, following which she continued her teaching service at MS Ramaiah Institute of Nursing Education and Research. Madam's achievements include: Madam was the academic topper in MSc Nursing, achieved Best Nurse and Women of the Year award from Gokula Education Foundation in the year 2014, Best Teacher in Medical Surgical Nursing Appreciation Award from CEO Gokula Foundation in 2015, and Madam was the organization committee member and speaker in a number of national and international workshops and conferences. Madam has published research and nursing education articles in nursing journals, was guide for MSc nursing students in Rajiv Gandhi University of Health Sciences, and guided a number of research projects for UG students. It is our pleasure you have accepted our invitation, ma'am, and we're eagerly waiting to hear from you. You're welcome, ma'am.
Thank you, ma'am. Now I request Mrs. Sujata Murthy to start the session. Welcome you, ma'am. Welcome you, ma'am.
Yeah. I thank the management of the Indian Academy, Principal Professor Mrs. Elizabeth Lena, Munmun Mukherjee, the staff, and the entire members of the Indian Academy for giving me this opportunity to speak today. Indeed, I'm privileged to talk on such a beautiful topic of nursing as a profession. And I'm so happy that there are so many registrations and the budding stars, the important members, the parents, and I can see a number of students getting registered from different states. So I'm very happy to speak to all of you all. And at the end of my session, you will get an idea about nursing as a profession or as a career, which will help you to decide on your future plans. And if you want to serve in the healthcare sector, it's in fact a very good area where you can select to become a nurse and who is a key person in the healthcare sector. So, I mean, at the end, I'll be briefing you on a number of aspects. Let us quickly begin with the presentations wherein I'll give you all the details about the nursing profession. At the end of my presentation, if you have any queries, I'll be very happy to answer. So, yeah, nursing as a career, which is a gateway to a bright future. Now, all of you must be wondering, who is a nurse? All of you all may have definitely visited the hospitals or healthcare centers and seen a person walking around who is well dressed, communicating to you all. So let me tell you, who is a nurse? And a nurse is a person who is trained, skilled, and licensed. Now, the term trained means here you need to have a basic qualification. Now, during my presentation, I will tell you about the different courses that are available to become a full-fledged nurse. Anybody and everybody cannot be just walking into the hospital and taking care of the patients. You definitely need to have a good knowledge and skill. Skill is the ability to do or to get the competence to carry out the care of the patient. So for that, you need to have knowledge and you need to develop the skill. And the third thing is you need to have a license to practice. Now, as doctors have the license, even nurses need to get a license from a professional body, which I'll be talking to you later. A professional nurse has to complete basic nursing education program and get a license in our country to practice professional nursing. Now here I repeatedly use the term profession. Nursing, let me tell you, is an independent profession and it is no more into a paramedical course. Now, when I talk about the nursing a nurse needs to get a license. For that purpose, you must know who are the licensing authorities in India. If you want to study nursing in India, the main body that is the licensing authority is the Indian Nursing Council. Now, Indian Nursing Council is the national regulatory body for nurses and also the nursing education in India. It is an autonomous body and it is under the Health and Family Welfare. Now, this Indian Nursing Council regulates the nursing education all over the country so that there is uniformity being maintained in the nursing education. So it is involved in the framing of the syllabus. Now, for a particular course, it could be BSc Nursing or GNM, the Indian Nursing Council frames the syllabus, and at the next level, that is State Nursing Council, it is being implemented through the universities and the boards. So in our country, in India, there are 29 state nursing councils which governs the nursing education in each state in the country. Now, let us look into the statistics of India. That is why there is a demand for nurses. Now, particularly in this situation, in the situation of the pandemic, COVID pandemic, you would be reading that there is a huge shortage of staff, could be medical staff, the nursing staff, and the paramedical staff in different areas. So if you will look at the Indian statistics, we have only 1.7 nurses per 1,000 population. Whereas the World Health Organization norm states that there should be 3 per thousand population. And if you look at the data, you will find that there is an acute shortage of 43%. And worldwide, the registered nurse workforce is projected to grow by 15% in the next decade. So here you can see the variation between the demand and the supply for nurses. So there is a huge demand for nurses, and therefore one can think about the possibility of nursing as a profession once you have completed your second PU. So our next point of discussion will be here. Why do you want to choose nursing, if at all you want to get into this noble profession? Let me tell you here that there are only few careers which offer same advantages as nursing. So there is, a great demand, just now what I said, and the supply of nurses is considerably low. Now, if you look at the Indian statistics, like we have about 3,155 nursing institutes for the GNM program all over the country, and there are 1,958 BSc nursing institutes in the country, and 1,890 nursing institutes which offer the auxiliary nurse midwife. As I go ahead with the presentation, you will get familiar with these courses. So what I have to say here is, though there are about 2.5 lakh nurses as freshers being graduated in our country every year, there is acute shortage of the nurses. So from this you can make out that there is definitely no recession in the nursing profession. So that is one of the positive aspects that you can choose nursing as a profession. Nurses make a real difference. So what do we mean by nurses make a real difference? Here, nurses work in the healthcare sector, and they are the key members in the healthcare sector. When a patient is admitted in the hospital, the doctors and the specialists do their job by diagnosing the disease and prescribing the medications. But throughout the period, right from the time the patient attends the OPD or outpatient department and even in the inpatient, the nurse is a person who is in continuous contact with the patient. So they develop a real rapport, and a nurse plays a key role in the care of the sick or the care of a patient. Patient, or in some of the contexts, they use the term client. The next point here I would like to highlight is that nursing degree programs exist everywhere. If you look in our country, I just mentioned about the number of the institutes. For BSc nursing, we have about 1,958 institutes. As per the latest statistics at the end of 2019, if you want to select nursing as a profession, so in every corner, in every state, there are nursing institutes that are present, and one can choose the institute or the college where they can study. Nurses can enter the workforce relatively quickly. This is another positive aspect. By the time a nurse is in the final year, maybe in the third year of the general nursing and midwifery, or the fourth year of the final term of the BSc nursing, they are in demand. The placement cells are ready or equipped to be absorbed. The nurses can be absorbed in the healthcare sector very quickly, even before the results are declared sometimes, the final year results, I mean to say. Nurses receive respect. Now, in olden days, nurses were looked down upon. That is not the situation now. In every person who comes in contact with a nurse knows the importance of what is nursing, or how the care by a nurse makes a difference. Supposing a patient is very sick, he is just unable to get up, even a gentle touch, a communication, or when when the nurse helps the patient to do the self-care, maybe dressing or bathing or even feeding. Those are the small, minor procedures, and of course, pain alleviation or reduction of pain. When the patient is in pain, a nurse plays an important role by treating the patient. So when a patient comes in contact with the nurse and they really know the difference, the patient and the family, they know the importance of nursing, and definitely nurses do receive a lot of respect in all the areas. Nurses hold high level of ethical standards. So this is nursing is a profession where there is a national code of ethics that is being given by the Indian Nursing Council, and which highlights the individual dignity. And individual dignity here means every individual needs to be respected regardless of who is receiving the care or from which nationality, ethnicity, religion, culture, socio-economic class, or gender. Irrespective of whichever class the person is, uniformity of care and that respect is being given. And that is how the nurses hold a very high level of ethical standards. Nursing profession boasts a very high level of satisfaction. This 100% is very true. When nurse makes a difference in the care of a patient, maybe he or she saves the life of a patient, or a pain is being relieved, or a person is being cured of a particular disease, you do not know how much a nurse receives the level or how much a person is satisfied. Nurses work with people. This is a very important aspect. In today's scenario, you will find people from IT industry or all the other industries, they work from home. That's become the new norm. And they are stuck to a particular table or a room, and they are with the desktop or laptop, or they are within the limited office space. But nurses, the role of nurses is not such. They work with people. Every time they meet new people, they meet their clients who are the patients, the family members, the caregivers, and they deal with day in and day out. They are dealing with the human beings. So that makes a lot of difference. And nurses can work in a variety of different environments. I'll be highlighting in which all different situations the nurses are working. And there is a lot of, again, satisfaction that a nurse may get. Nurses never stop learning. I mean, they don't stop with a degree or a diploma, and after getting a degree, they go for the higher level masters and PhD. Even if they have attained a PhD, every day is a learning experience for them. So since they work with the people, and they can translate that learning experience into the real life. And nurses in turn again learn from the cultures, the people, and also the different lines of treatment. Definitely there is a lot of learning that takes place when you are into the culture. For example, a nurse comes from maybe West Bengal to Karnataka to serve. The nurse learns about the culture of Karnataka, maybe the diet type that is followed in Karnataka, or even the healthcare facilities or the culture that exists in our state. Nurses can use their competent skills even outside work. This is definitely correct. It's not only in the hospital or the clinics or in the healthcare sector where a nurse works, but even she uses her competent skill within the family. Supposing a family member gets sick, the nurse is being contacted to get the advice on the line of treatment or what needs to be followed. Even a minor ailment like cold or cough. In these days, again, getting cold or cough is a major problem. So what could be the, even nurses well equipped with the knowledge of home remedies, and besides home remedies, they go for the other lines of treatment. A nurse can be an important source of the information and also the care. Not only the basic ailments, but you could face day-to-day problems. When you're traveling in a bus, maybe you see a patient or a person collapsing with a cardiac arrest. Nurses are well equipped with the cardiopulmonary resuscitation or even the first aid that needs to be given in case of an accident. If there is an accident, nurses are well versed with the first aid, and that's how they can make a difference. So even outside the work, nurses are recognized. Nurses can change jobs relatively easily. Nurses have a license from the State Nursing Council, and also let me mention here that there is an NUID being issued by the Indian Nursing Council. So that is a registry. There is a registry that is nurses registration and tracking system that is being maintained at the national level, and there is a unique ID that is given to each nurse. So with the help of the State Nursing Council registration, and also the records in the NUID, one is able to change the jobs relatively easily, maybe from one organization to another, and also from one state to another when it is necessary. And nurses can use their expertise to begin a new career. One may not be stagnated in one particular career. Maybe a nurse is working during the initial stage in a hospital as a staff nurse. Later on, maybe due to certain reasons, they can switch over to the teaching line, and wherein they play the dual role. It's important here again, working in the education sector and as well as in the hospital, in the service sector, which can go hand in hand. Or in case a nurse wants to become an administrator at a senior level, they can go to that level. A nurses can get into the research work. That is, he or she can be a nurse researcher. Every time, commonly I use the term she because there is a common concept that nursing is a female-dominated profession. But don't have that inbuilt concept. I can see a number of boys who have registered here, and those who are also interested in nursing, they can definitely get into it. Even men can make a lot of difference. So if if you look at the statistical data, about 10 to 15% of the nurses are the males. So it's not only a female-dominated profession. Many boys are also getting into the profession, and they are coming out with flying colors. Now, after I have given you about the information about all these details as to why is it important to choose nursing, let me tell you what are the different courses that are available in India. One is the auxiliary nurse midwife, which is a 2-year course. General nursing and midwifery is a 3rd-year course. According to the Indian Nursing Council, most probably this is the last batch, that is 2020-21 will be the last batch, and most of the schools are going to be upgraded to the colleges, and there is going to be a uniform education of basic BSc nursing, which is a degree course which is of 4 years duration. And MSc nursing is a master's, wherein you get a master's degree, which is of 2 years duration, and there are you can get specialized in medical surgical nursing, community health, obstetrics and gynecology, pediatrics, and mental health. And further is the PhD. There are also MPhil programs in the nursing. PhD can be completed with a part-time and it can be completed in 5 years. So you can climb up the ladder. Sky is the limit for nursing, I can say here. Let us quickly go to the details of the eligibility criteria for the ANM. Auxiliary nurse midwife, the age shall be 17 years on or before 31st of December, and maximum age is 35 years. And minimum qualification is 10+2 with all the subjects that I've mentioned here: maths, physics, chemistry, biotechnology, economics. So if you are interested in nursing, you can get into the diploma course, and the student should be medically fit. And students qualified in 10+2 arts or science examination conducted by National Institute of Open School, and they can be admitted once in a year. Same thing applies for the general nursing and midwifery, which is a 3-year course, 10+2 with English, and they must obtain a minimum of 40% at the qualifying examination. The state open school recognized by state government and National Institute of Open School recognized by central government, those candidates are eligible, and however, science is preferable because subjects like anatomy, physiology, which are there in the courses, becomes much easier for a science candidate. 10+2 with English having 40% of marks, and vocational A&M course from school recognized by Indian Nursing Council, and also vocational stream healthcare science from recognized CBSE board. 10+2 with English is mandatory, and registered A&M with pass marks. Eligibility criteria for BSc nursing, the age remains the same, 17 years. Minimum education is 10+2 passed with science at English core, elective with aggregate of 45% marks, and they can get it from any recognized board under AISSE, CBSE, ICSE, SSE, and HSE. Students shall be medically fit, and students appearing in 10+2 examination in science conducted by National Institute of Open School with 45% marks, and they shall be admitted once in a year. Besides all these courses, and also I have said about the eligibility, if a person has completed the GNM course or General Nursing and Midwifery, they can get into a post-basic BSc nursing program, which is of 2 years duration, and they can climb up the ladder. So the diploma can be enhanced to the degree by taking up this program. There are also post-diploma specialization courses which are recognized by the statutory body, that is the Indian Nursing Council, and each of these specialities do have their syllabus, and the duration is of 1 year. Quickly, to mention the cardiothoracic nursing. Cardiothoracic nursing is related to the diseases of the heart and the chest diseases. Critical care nursing is related to the sick people. Many times you would have heard about patients being admitted in the intensive care unit. The moment you hear that a dear one is admitted in an intensive care unit, you really get scared about the outcome of the condition of the patient. And here it's again a highly specialized care. Indian Nursing Council has introduced even a nurse practitioner in critical care nursing course, wherein a nurse can really take care of the patient who are very, very sick in the critical care unit. And the next specialty is that of emergency and disaster nursing. They can get in cases of emergencies and disasters, could be like earthquakes and building collapses and so many other disasters do work. One needs to be really competent enough to take care. And next is the neonatal nursing. Neonatal nursing is related to the care of a newborn baby. It's so nice to see a newborn baby, but many a times even these newborns may have certain health issues. So to take care of such babies, there is a specialty of neonatal nursing. Next is the neurology nursing. So that is again another specialization which deals with the diseases of the brain and the nervous system. And oncology nursing is related to the care of the cancer patient, which again requires highly specialized care. Operation room nursing, the moment you hear that any of your near or dear one is going to be operated or is going to be posted for surgery, again, you need to have a special team in the operating room, and a nurse has to be well versed with it. Again, you can take up a specialization course in this. Psychiatric nursing is another important specialization, wherein, day in and day out in today's life, right from childhood, child is under stress. Even when you are in the first and second PO, parents are under stress, so you are under stress, and there are a number of roads or to select a particular career. And also, even when a person is into a particular career, day in and day out, they have to face stressful situations. And there are a lot of mental health issues that are coming up. So psychiatric nursing is an important specialty which can be taken up. Orthopedic and rehabilitation nursing, which is related to the diseases of the bones and the joints. So if a person meets with an accident and maybe he has lost a limb, that doesn't mean that it is the end of the life. A limb means maybe a lower limb, he has lost a leg or a hand. A person has to learn to live without that particular organ, and rehabilitation nursing definitely plays an important role. Geriatric nursing is another area wherein, in the entire world and also in India, aging population is increasing, and there are special issues with the aged. Many of you definitely may have old grandparents and also great grandparents, and you may have noticed that they have a lot of issues. Maybe they are unable to move, or they have joint pains and a problem with the vision, hearing, problem with communication. So definitely you can get specialized in geriatric nursing, which is related to the old age population. Next is renal nursing. Renal nursing is related to the diseases of the kidneys, kidneys and the urinary bladder. A number of conditions, and in the present scenario, with the number of diseases increasing, like you may have heard about diabetes and high blood pressure or hypertension, common complication is that of the kidney failure. So here is where a renal nurse can play an important role. Burns nursing, you need to be specialized in taking care of a patient who has burns. The next important fields are hematology nursing and forensic nursing. These are the new areas again which are being implemented by the Indian Nursing Council. Hematology nursing deals with the disorders of the blood and the circulatory system. Forensic nursing is another important area which is being introduced, wherein a nurse plays an important role. You may wonder what a nurse is going to do in the forensic nursing. In today's scenario, the nurses can play an important role in evaluating and caring for the victims of assault, domestic abuse, child abuse, elder abuse. These are the day in and day out you read in the newspapers about these common incidences. So as and when a nurse is taking care of such abuse cases or abuse victims, a nurse can collect a lot of information which can be an evidence for further investigation in forensic, and forensic nursing is an important area. And the latest course that is being announced by the Indian Nursing Council is a bridge course for registered nurse and midwives. Now, this course is for nurses who have completed their diploma or a degree course and they want to seek a job overseas. So this is recently declared by the Indian Nursing Council, and the duration of this course is 3 months, where a nurse can get specialized, or she can, in whichever country she wants to work. Then our council and also the institute where a nurse takes up the course can be eligible, or the nurse is prepared to go to the higher level or can work abroad, and the requirements can be fulfilled, so that to work legally, a work visa has to be obtained. And that can be done easily by this bridge course. Now, you must be wondering, when there are so many opportunities, and in case you want to get into nursing, what could be the fee structure? For BSc nursing, in different areas and different institutes, depending upon the rural and the urban area, you will find a variation between 60,000 to 1,50,000 per year. This is, which may or may not include the food and the accommodation. It is, again, depends on the state and the institutional policy and the type of the facilities that are being provided. For general nursing and midwifery, it is 40,000 to 1 lakh per year. And besides that, there are other courses that I mentioned, that is the post-basic BSc and MSc. So it depends, like on the job, if they are undergoing the course, the institute assists the person, maybe or they are on contract, or otherwise maybe anywhere between 1.5 lakh to 2 lakh per annum for an MSc course. And for post-basic BSc, again, it may vary between 60,000 to 1.2. This is the approximate fee structure that I have given from this data that I have got. Now, you may be wondering, where, or is it only the hospital that a nurse needs to work in? Definitely not. I told you, you can work nurses can work in different environments. Definitely, first is the hospital, which provides a base or a basic learning experience. This is a place where you meet the clients. Very often in most of the books, it's not the patient, but the client that is the term that is used. So it is in the private and the government hospital. There are also corporate hospitals that are available, and you must be seeing nurses smartly dressed who walk around and taking care of the patient and communicating to the client and the relatives. Next is the nursing homes, smaller nursing homes, clinics, maybe outpatient clinics or multi-speciality clinics. They can work in orphanages and old age homes. Orphanages also, there are a lot of health issues. If it's a big orphanage, children may be, or even adult orphanages, they may have health issues, or even for day-to-day care, assistance may be needed. Old age homes. I told you, geriatric nursing is a very important specialty that is coming up. They can work in old age homes, and they do make a lot of difference here. One can work in army nurse, or there are also, like AFMC, Armed Force Medical College at Pune, offers a BSc nursing course. And also, if you undergo degree outside, one can get absorbed in army, navy, military. A nurse can work in schools as a school health nurse, in industries as occupational health nurse. Railways is an important area or industry which comes under the central health government. In fact, in almost all the states and major cities, there are railway hospitals, and very regularly you will find the recruitments taking place for the staff nurses. And home care is another important area. Like, in the present pandemic situation, you would have heard that the tests are being done, and many of them prefer, like if the patients are or the clients are asymptomatic, they prefer to be taken care of at home. So that is the home care. Or even if a patient undergoes a surgery and is discharged, for example, I say a heart surgery, and if he is discharged by 4th or 5th day, they may require a follow-up care. So that can be done by home care nurses. Palliative care and hospice care are again two important areas where nurses can work. Palliative care is like a patient, for example, a patient is suffering from cancer. In certain types of cancer, there is severe pain. A nurse plays an important role in alleviating, I mean to say, in reducing or making the patient comfortable and to see that the patient's pain level or discomfort level is considerably reduced. And a nurse does make a lot of difference. Hospice care is the area where a patient is in a state of terminal illness. Here, what I mean to say is terminal illness is, there is no cure for that particular disease, and maybe the patient himself or the family knows that, nothing more can be done in this particular case. Here, a nurse can play an important role to give a dignified care for such a person. Next is ambulatory care center. You would have heard about, this is applicable mainly in orthopedics, like if a patient is had an accident or has a lot of physical disability and the person needs to be ambulated, or even after a major surgery. That means movement. A person needs help in the movements. So along with the physiotherapist, nurses do play an important role in the ambulatory care center. These aspects you will understand once you get into the nursing. Nurses can work in corporate offices. Everybody is attracted to the nice buildings or in the corporate offices and the luxuries that one enjoys in the corporate offices and the facilities. So once a nurse is expertised or after gaining a little experience in the hospitals or the nursing homes, they can opt to work in the corporate offices where they have clinics and they can take care of minor ailments under the direction of the physician or the doctor who is being appointed in the corporate offices. They can play a next area where a nurse can work is in the de-addiction centers and also in the prisons. Prisons, again, nurses do play an important role. A lot of health issues do occur even in the among the staff in the prisons or also the prisoners. They need to be taken care of. So after going into the various areas, it's not only the hospitals or the nursing homes one needs to work. There are different roles that a nurse can play. Initially, nurses can be employed or they are employed as a staff nurse, could be a fresher, junior staff nurse, then is the senior staff nurse, and then is the nurse manager. And of course, at the managerial level, different hospitals might give different designations. You may have heard in the government sector, maybe the nurse plays a role of the nursing superintendent. Those are the administrative roles. Nursing superintendent, different grades are there, or even in government sector, older term that is used is the matron. But the newer terms are the nurse managers. Nurse managers can be at the unit level and also at the hospital level at different grades, level 1, 2, 3, and so on. A clinical nurse specialist. I have mentioned about the different specialization courses. And once a nurse undergoes these specialization courses, they can be appointed as a clinical nurse specialist. Nurse practitioner. I was mentioning about the critical care. Indian Nursing Council has introduced nurse practitioners course in the critical care unit, and also, this is a residency program where a nurse becomes an expert in taking care of the critically ill patient. And also they can work in the community health center level as nurse practitioners. Nurse educators. You may be wondering, how a nurse can be an educator. So once a person completes a baccalaureate degree or bachelor's degree, BSc nursing and MSc nursing and PhD, they can be nurse educators in the School of Nursing, College of Nursing, and also in the hospital setting. There is something called as continuing nursing education. For that purpose, a mentor needs to be there. So a nurse educator plays an important role. And research is introduced right from the diploma program in nursing. So they have a concept of what is research, either in the diploma degree, maybe in the form of smaller projects, and also at the MSc level, there is something called as a dissertation, where a research project can be taken up, and that's how a nurse becomes an expert. Even if a nurse doesn't attain PhD level, a nurse can participate in the work of research, help in the research activities in the healthcare sector, and he or she can be an important member and become a nurse researcher. And as I said, the sky is the limit in any of the area one can work, and ultimately with a lot of experience. And these days, you don't even need an experience. If you have a good idea, a nurse can become an entrepreneur. You can start off a nursing bureau, with additional responsibilities and maybe family responsibilities. A person may not be able to contribute to the hospital. Maybe a nurse may not be able to work for about 8-hour shift or 12-hour shift. They can switch over to the other areas. They can participate in research or entrepreneur program. So they can start off their bureau, or even they can do the marketing of certain healthcare products and so on. So if you have different ideas, definitely you will shine as a nurse entrepreneur. After I have talked so much about nursing, you may be wondering what could be the pay package a nurse would receive. As a fresher, like in any other field, the variation again from the data that is available, I have just given a range here. It could be even higher than this. Freshers will receive about rupees 10,000 to 17,000 per month. Mid-level, maybe once a person becomes a senior staff nurse or so, 17,000 to 37,000. Highly experienced could be when a nurse has a dual role to play, the hospital as well as in the education sector. Variation could be 48,000 to 80,000, maybe as assistant professor, associate professor, professors, and so on. Very senior level, the highest level at the corporate level, if you're working, definitely the sky is limit. You can draw even above a ladder. Gradually, you climb up the ladder. Which are the top countries for nurses to work and live? Definitely, I will suggest it's our own motherland where we study, we need to work, but let us not limit. In case we want to expose ourselves, we want to have a little experience in other countries. The other countries one can opt as, in order to make money, supposing if that is again another motive. Everybody definitely needs money, one earns, and the service-minded one has to be. So you can also work in other countries which are good places to work are in UK, Dubai, Ireland, Canada, USA, New Zealand, and Australia. Definitely after you undergo the competent exams and you get a legal work visa to work. After hearing to all this, and you may make up your mind, you may want to discuss, or parents may think about it. And ultimately, it is the candidate who want to get into the nursing. You need to think, is it the right career for me? Let me tell you here is, nursing is an ideal job for those who want to serve humanity. You need to be service oriented. You may come across different situations. So if you need to be compassionate, and you need to have an immense willpower and spirit to serve the sick and the weak. Like, it's not like we move around in well rest, but if a person is very sick, and every stage, like even in the hygiene, care of hygiene, a patient, those are the basic cares that a person requires, like feeding, and then comes the administration of medicines, like could be the tablets or injections, all those will come later. But you need to be compassionate, you need to communicate with the person. It's not necessary that you have to know. Supposing a person comes from West Bengal to Karnataka, there's no issues if you have the basic language knowledge, like maybe English, you know, a little bit of Hindi. Slowly you will learn the local language. There is nothing big in it. Definitely you can migrate from one place to another, but you know, the verbal communication and non-verbal communication does play an important role in caring for a person. So you need to be compassionate, you need to communicate well, and you need to have the ability to care and ability to manage different situations. You don't know in what situation you're going to be. Like, you know, I will quote an example. I was a first year nursing student. This is way back in the year 1983. And on second day, I was given a patient who was very, very sick. I had never seen such a sick patient, as an unconscious patient. I had never seen at the age of 18, where, you know, in the same situation as you are, I was once upon a time in that situation. For a moment, I was stunned, but then I made up my mind for what. I mean, I have a calling here, and I'm here to serve the humanity. I was able to proceed with the care of that sick patient. Even today, I remember the name of that patient and the situation in which I was. Next is willingness to adapt to new technology. So, you know, the world is changing at a faster pace. There is newer technology. In early 80s, we did not have anything like a desktop or a laptop. We didn't have adequate knowledge about the computer. We were using, I mean, all the recordings and everything was done on a paper, and communication was through, I mean, we did not even have a mobile phone, telephone. You're blessed with the newer technology. And communication was not that faster, but in spite of that, we were able to do it. And even at this age, even at the verge of retirement, I am in a position to adapt to the newer situations. You know, we did not have any disposable items that time. Syringes, for example, that are given for injections, we were supposed to, disinfect them and reuse after autoclaving. But today the technology is advanced. Everything is available. Most of the things are disposable items, and the technology is so much advanced that everything is available at the click of a mouse. And also, let me tell you, the clients that we get are well versed, or they already have a lot of knowledge about the disease conditions and so on. So a nurse needs to, there should be a readiness or to adapt to the newer technology. Now, after I've spoken so much, to conclude, you know, let me tell you, when you are a nurse, you know that you will touch a life, or a life will touch yours. As a nurse, with my own experience, you know, I've taken care of a number of patients in the hospital as a senior nurse in the hospital, or even as a nurse educator. I always like to work at the bedside. And even neighbors, many a times, many of my neighbors do remember me for the care that I have given the hospice care or the palliative care that I have given. That is, of course, with the experience. And nursing is the heart of helping and miracle of hope. You know, even if a patient is having a severe discomfort, a helping hand that you render and an assurance that you give that everything is going to be fine, that hope alone does play as a miracle. And let me tell you that, you know, you will not repent to become, if you choose nursing as a career, definitely you will climb up the ladder, the sky is the limit, and you will achieve a lot of satisfaction after a few years of working, or even as student nurses. I'm sure you will enjoy under the proper guidance if you select the right type of the institute. So once again, I thank the organizers for giving me this opportunity to speak to you all and to give you a brief idea about what nurses, and I've sown the seed. You can think about the nursing as a profession. And if you have any queries, I think you can, I'll be happy to answer through the moderator who can put up the questions. So thank you, and the presentation is open to answer the queries. Yeah, over to the moderator. Over to the moderator.
Ma'am, one student, Partho, he wanted to know, ma'am, I want to know about the army nurse. What are the requirements will be needed for army nurse after completing BSc nursing course? Is there any opportunities to do job as a male nurse, a male army nurse after completing the BSc? What all requirements is needed for that?
So in the army nursing, first preference, let me tell you, is given to their own trained people. Like you have the Armed Force Medical College. But still, when there are openings, you have to see to the recruitment agencies, and the basic education, that is the BSc nursing program, and you need to have the registration. Whichever state a person is trained in, they can apply for it, and after they may have to undergo the process of a written test like any other government organization. You know, they have to go through the interview. The initially will be the written test, interview test, medical fitness, and then with their own training in the medical center, they can definitely be appointed. But you have to clear the hurdles like in any other government organization. Same thing applies for the railways. You will see a number of openings even in the railways. So wherever the postings are, they can be given, but initially you have to clear their exams for the openings that are present. And one has to check on the on-site.
Okay. Thank you, ma'am. I think you have cleared all the doubts of the students, so I don't think so anybody has a doubt. They're all cleared. Yeah, because the session was very informative, interesting, and information revealed was apt for the youngsters who all want to pursue career in nursing. It is detailed information about the noble profession, ma'am. We are all grateful to you. You have taken your time out of your busy schedule. We know you are a bit busy to address our group. You gave an awesome presentation. You are a great communicator. We thoroughly enjoyed the webinar. It was very clear, concise, organized, and nicely paused. Thank you, ma'am. You are always a great motivator and a orator. And I thank management, principal for giving this opportunity to conduct this webinar. Thank you all who all have attended this webinar. Thank you one and all.
Yeah, once again, I thank you, the management and the staff of the Indian Academy. Even I enjoyed talking to the group. Thank you so much.